In every community across Canada, families experience health in very different ways. While medicine and genetics play an important role, much of what shapes our health happens outside of the hospital walls. From the homes we live in, to the food we eat, and the care we can access, these are the social conditions that quietly influence our well-being every single day. This short documentary is designed mainly for nursing students who want to better understand how the social determinants of health affect family in Canada. Together, we'll explore three major factors: housing, access to healthcare, and food security. We will also explore what they mean for nurses working with families in diverse communities. The Public Health Agency of Canada defines social determinants of health as the non-medical factors that shape health outcomes, the environments where people are born, grow, live, work, and age. These determinants are influenced by how society distributes resources and opportunities. When housing is secure, food is available, and healthcare is accessible, families are more likely to thrive. But when these conditions are unstable, health outcomes decline, often through no fault of the individual or the family. Poor living conditions such as dampness, mold, inadequate heating, or overcrowding increases the risk of respiratory infections and heart problems. For nurses, housing isn't just a social issue, it's a health issue. Recognizing the impact of poor housing helps nurses advocate for safe environments and connect families with community housing supports. Access to healthcare remains unequal across many parts of Canada. According to Statistics Canada 2024, people living in lower income or rural areas are less likely to have a regular healthcare provider. For some families, long travel distances, transportation costs, or lengthy wait times create major barriers to care. Nurses are often the bridge between families and the healthcare system, helping them navigate complex services, find primary care, and advocate for equitable access. By supporting families in these ways, nurses can help prevent delays in treatment and promote continuity of care. Food is fundamental to health, yet 1 in 6 Canadian households experiences food insecurity. Families facing food shortages often experience poor nutrition, stress, and higher rates of chronic disease. As Loopstra and Tarasuk 2022 note, food insecurity isn't about poor choices, it's about poverty, income inequality, and inadequate social policy. Nurses can play a critical role by screening food insecurity, linking families to community food programs, and advocating for broader policy change. When families have reliable access to nutritious food, their physical and mental health both improve and their resilience grow. Understanding the social determinants of health isn't just for public health professionals, it's essential for all nurses. When nursing students learn to assess families holistically, they see the person beyond the illness. Study shows that integrating SDOH into nursing education enhances empathy, advocacy, and critical thinking. This approach prepares future nurses to act as change agents, both in clinical settings and the policies that change Canadians' healthcare. Reflecting on housing, healthcare access, and food security reveals how deeply social conditions affect family health. For nurses, this means providing care that goes beyond symptoms, care that listens, advocates, and connects families to the resources they deserve. When we integrate the social determinants of health into everyday nursing practice, we move closer to a healthcare system rooted in equity, empathy, and compassion. Together, we can help every family in Canada build a healthier, more secure future.